And welcome back to Sunny Side Up. Thanks for being here. If you didn't know, May is Women's Health Month, and we're joined this morning by Dr. Cheryl Morrow-White. She's with the Buckeye Health Plan, and we're glad you're here to speak with us about important issues. Sometimes, you know, lives get busy and things pass by. What is the #1 health element issue affecting women today?
The most important health challenge for women, believe it or not, is heart disease. And we at Buckeye Health Plan and the entire health community knows that most women over the age of 40 have at least one risk factor, be it hypertension or obesity or some of the others, for developing heart disease, which is a killer.
So we know moms are just so busy. Women in general are often not only taking care of their kids, they're taking care of the household, they're taking care of their aging parents, spouses, or family members. So they get wrapped up. Somebody that's watching right now thinking, hey, that's me, what would you tell them?
The first thing is that your health has to be a priority for several reasons. One is because you can't continue to take care of the others if you're unhealthy. And the second reason is that you really have to be a priority, and you set an example then for all of the people whose lives you touch about making health your #1 priority. You can't serve others if you're unhealthy.
We hear so much about prenatal and postnatal care. What can you tell us about that?
Well, Buckeye Health Plan actually has a program as a managed care company called Smart Start for Babies. And there we try to encompass and surround new moms, pregnant moms, with the supports that they need to assure them of a healthy delivery and, as best as we can, a healthy, happy baby.
Yeah, support system is so important. And, you know, one of the things I always think about, too, is mental health. We know stress can be so detrimental to women's health.
Correct.
And it's always that notion, and not just women, but we all do it, men and women. It's just, you know what, I'll take a break later. I'll take a break later. But that can really affect people's health physically.
It can. And we are learning that even just as with exercise, with stress relief, if we just take small breaks in our day to attend to our needs, we can avert and avoid some of the larger issues. We need to take time to breathe and to recreate ourselves during the course of a day.
Neha kind of mentioned you know, the complexity of life. You're doing so many things. What are some more steps that we can take to kind of live a more balanced life?
We know the steps, the difficulty is in enacting them. And this is the end of Women's Health Week. So that's why Buckeye wants to emphasize to women that the most important thing is calling and making that appointment, keeping that appointment with for your preventive health care, openly discussing with your primary physician, having dialogue about your health so that you really understand why you're getting the recommendations. And then the most difficult challenge, following through on the recommendations.
And I'm thinking too, even when it comes to men's health, just having that conversation that you should call your guy friends, call your dad, your grandpa, in this case women.
That's right.
And kind of put the pressure on them to make that appointment.
That's right, making the appointment. In fact, I would encourage women here at the end of Women's Health Week, call today. Rather than putting it off, call today, make that appointment, and follow through.
And is there anything else you want our viewers and, you know, women and family at home to know about?
This is really a call to action for women in terms of their health. The end of this week signals the point at which you really can begin to take action. And the most important thing is that you're worth it. You're worth the time that you invest in keeping yourself healthy.
Yeah, such a great message. And again, your self-care and self-worth go hand in hand.
Correct.
All right, thank you, Dr. Morrow-White, for joining us this morning.
Thank you both.
We're going to take a quick break, but we'll be right back.